Hello to everybody. Well, it's my pleasure to share with you what is the way I work because it's one thing that many doctors ask me every day with many different ways. They ask me, well, Dr. Diego, how is possible that you are achieving these amazing results with Invisalign? And well, as I always say, the secret of everything is in the first working with a lot of passion. And well, everybody who knows me, you know that I'm a really passionate orthodontist. I live this profession with the heart. So I'm always trying to get the best results. I'm always trying to give the best to my patients. And of course, you need training. You know, to know how is the biomechanics when you move teeth with aligners instead of moving teeth with braces is completely different, okay? So you have your passion, you love what you are doing, and when you invest time trying to learn how it works, you can achieve the same result that I'm achieving. So I want to show you, well, the way I have worked with one of my patients in order to let you know understand what is the procedure that I do with my patients before starting with the case, okay? So let's see this patient who came to my office. She came to my office complaining a lot about her smile, and what you can see here is, wow, it's a really terrible smile, and she hated it. And well, she came from she had visited about 4 offices before, and everybody told her that it was impossible to solve this case with Invisalign. I always say that you have to try to learn about all these things, because if you don't know how to do it, some doctor like me is going to treat these patients. So if you don't want to lose patients, I recommend you to understand and to learn and to study a lot, okay? Not only to give the best for your patient, also not to lose your patient when they come to your office, okay? So look at the smile. What you see here is a really narrow smile. We have a different proportions in the incisors, and also gingival smile, gamma smile in the posterior zone and also in the anterior zone. This is the occlusal view, where you can see this class 2 that we have here in the right side. Look at the edge-to-edge occlusion, and the most important for me, look at the posterior. When I look to my patient, the first thing, my eyes go first here to the posterior zone, and look how is the angulation of the premolars in the upper and in the lower arc. And because of this angulation, we'll see what is happening. This is the captures of the clean check in the beginning, when I'm going to do the planification, and you can see many things, no? A lot of information here. We look at these contacts between cusps that we have in both sides, the negative angulation, the negative torque in the lower incisors, and also a bilateral class 2 in both sides, and well, this tendency here of an open bite, okay? One thing that I love to study a lot is about the arc shape. You can see this arc shape, really narrow arcs, and coordinated with this narrow arc, you can see here how the molars are rotated. So you know, when you work with braces, you put arcs and braces and an arc, you put the first arc, and everything starts with the expansion, and the molars starts the rotating at the same time. But it doesn't happen with Invisalign. You know that with Invisalign, you have to do the planification of everything. If you want to change this arc shape, and if you want to derotate the molar, you have to do the planification of the expansion and the derotation. You have to tell the technician in what moment you want to do the expansion, in what moment you want to do the proclination, in what moment you want to do the rotation, okay? Because you have to sequence most of these movements in order to get the best result. You have also to think about what side are you going to use as anchorage, where are you going to put the attachments, when are you going to do the IPR, where are you going to do the IPR, the amount of IPR. So these many things you have to think about that in order to get the best result. Okay, this is the X-ray, the same record that we take to do the planification that we do with braces, but I'm showing you all these things in order to let you know that when you plan a case with Invisalign, it's not just sending the impressions, let the technician work, receive the aligner, and that's it. If you do that, you're going to fail, of course. Like 99% of the doctors all over the world are failing with these cases. Okay, so we do the planification and also look at the problems that we have here. Why we have this problem here? Look at the amazing loss of the gum that we have here. Why? Because we have this huge negative torque in the premolars. And if we look the 3D model in the back, this is an amazing tool that we have with the clean check. You can see the contact that we have between buccal cubes against buccal cubes. So this is amazing to study because it gives us a lot of information, okay? So we're going to start doing our planification. Things that we have to think about. What is the cause of the speed curve? What is the problem? Why we have this tendency to an open bite? Well, the things we are going to study, the shapes of the arcs, okay? The negative torque in the premolar, the contacts that we have in the posteriors. These are all these things that I study. Why we have this class 2 is a sagittal problem, or in this case, it's a vertical problem caused because the posterior rotation of the mandible. What is the cause of all these things? These are all these things that I think about when I'm doing the planification of the case, okay? So we think about the phases in orthodontics, and first we're going to solve the transversal plane, then we're going to solve the vertical plane, and after that we are going to solve the sagittal plane using a class 2 elastics, okay? We need to finish the case with this overjet. If you have class 2, you need overjet to solve the class 2, remember that, and you have to do the planification about what is the torque you want in the crown, but not only in the crown, also in the root. You have to tell the technician exactly the amount of degrees you want to increase, the sequence, if you want to do first the crown proclination and also the root proclination. And remember that if you are working with that class 2, remember that you have to finish your clean check not with contact in incisor, you have to finish your clean check with this overjet. This will help you to solve the class 2 in the future. Okay? So, well, what we do is we are going to use class 2 elastics, we are going to finish with some overjet, and we are going to do the IPR. These are the different attachments that I'm going to use. Horizontal attachments in the posteriors, incisors, optimized attachments to the rotate. I'm going to use this horizontal attachment and I'm going to place it to help to the molar to do the rotation. Okay, it's really useful in these cases. Okay, and in the lower R, these optimized attachments to help me to solve the rotations, and this horizontal attachment that I'm going to use to help me to do the intrusion in the lower incisor that you have seen before, that we have a really increased lower speed curve. Okay, so this is my planification. What I'm doing first, transversal expansion, and after that I'm going to do the vertical correction of the problem. Okay, but I'm not doing transversal and vertical at the same time. I'm doing a good development of the arc shape. The first thing, I'm putting the roots of the premolar inside the bone, so I'm going to also to help the gingiva to get better and better, improve the occlusion, improving the angulation, and after that we're going to do the vertical movement. Okay? Different views is exactly the same. Look how I'm changing the torque. Okay, it's amazing how we can do arc shape development and also crown torque and lingual root torque. That's what I'm doing in this case. Okay, and of course all these movements are I have done the planification of this movement. Okay, the technician sent me something completely different at the beginning. Okay, and I have changed. Maybe I have done about 4 or 5 clean checks before accepting the case, okay? After that, still on treatment, but look how we change a lot the torque of the premolars, good engagement in the posterior zone, good overbite. Look at, we have solved a nice, now we have a nice class 1 in both sides. We center the midlines, okay? The overbite is perfect. Nice and beautiful arc. Look at the rotation that we had at the beginning, and now I did a good arc shape development, and also they rotate perfectly the molars. It's amazing because now the arcs are coordinated. And look at the final result of the smile. What do you think about that? It's incredible. Why? Remember at the beginning we had a really narrow arc, and look at this smile. We get what she was looking for, a beautiful smile, and we were looking for a beautiful and nice occlusion. Remember, from the beginning to the end. Okay? From here, from the beginning, and the evolution of the case to this beautiful engagement. Okay? How we change this arc shape with this crowding, with this rotation, and look at the evolution. Everything is solved. After that, it's time for my sister, that she does amazing work in aesthetics. She's going to do a composite veneer here. She did the planification about the shape she wants to achieve, and look at the amazing result. It's like magic. Now everything is in balance, and the evolution of the face, that is amazing, how we change from here to this beautiful result. Okay? So the key here in this video, I want you to learn that Invisalign is really powerful, but it's really powerful when you give them a lot of information, okay? If you try to get a good result just taking impression, giving a few comments in the clean check, you are going to fail in most of your cases, or you are going to obtain some results, okay? I think that the key to have a lot of patience is to get at the end this result, because the best commercial for you are these patients. Okay, now she's really happy, and of course we are really happy of having the results, and of course I'm really happy to sharing my knowledge with you about what is my expertise with Invisalign. So I will be sharing many things, and it's my pleasure. So if you want to leave me some comments on YouTube or in Facebook, please feel free. That I receive many questions every year. Probably I can't answer the same day, but for sure, in not many times I will answer all the questions. Okay? So thank you very much for being there, and see you soon.